during the first initial visit, when we see a patient, we ask them what's their apprehension level. We try to determine what are they afraid about. Based on that, we do determine what would be the best option for them. And definitely the lowest level of sedation that we provide is nitrous oxide, that the patient, it's called laughing gas. So it helps to relieve a little anxiety, as if patient had a glass of wine. It takes a little edge off from their anxiety, which is the lowest level compared to the highest level of sedation, which we provide something called oral versus IV sedation, where patients are nice and relaxed, comfortable while we work on them. The reason it's called conscious sedation and not a general anesthesia, it's because patient is still awake. Say if they do want to use the restroom, or if they feel anything, or if they want to do something, like they can still communicate with us. But most of our patients are so comfortable that we can perform as many dental work at the same visit. The other beauty of sedation is also we can combine all the treatment at one visit, so patient doesn't have to make multiple visits. That way patient doesn't have to go over that same anxiety level every single time when they visit to dental office. Also, the other beauty of sedations is also where patient has very little memory. So some patient who doesn't like about thinking about the noise or thinking about what's going on, they have very minimal recollection of the procedure. Most of our patient only remembers, like, in the beginning when they came to the appointment and when they left the appointment. That's all they can recollect. They don't know about what's going on during the time of the procedure. Most of my patients really love that because they don't have to worry about anything, and that really helps them to elevate their anxiety level during the future visits when they come in.